that way. Let's get to number 5, which is similar to the dental clinics, but it has to do with kidneys. Here in the US, lower-income people are disproportionately plagued with kidney failure, a disease where your kidneys fail and your blood can't be cleaned by your kidneys, so you need a machine called a dialysis machine to clean your blood for you. Luckily, since the 70s, the United States now heavily subsidizes people who need dialysis for their kidneys. And dialysis is meant to be a temporary intervention while you wait for a kidney transplant. There's always a long waiting list for a kidney transplant, so you're on dialysis until you can get a transplant, which increases your chances of living. It is a wonderful thing that the government subsidizes this because it saves a lot of lives. But inevitably, here comes the exploitation.
Overnight, it instantly created an industry opportunity to offer dialysis because now the government was going to pay for it.
One of these companies is called DaVita. I think they're the largest dialysis center company in the United States. And because of this set of incentives, we can start to piece together how they would behave.
And the thing again about dialysis is, like Medicaid dentistry, it's a volume business. The government pays dialysis centers per treatment, and last year was about $380 per treatment. So it is unfortunately in the interest of dialysis companies that run dialysis centers to keep those machines occupied as many hours of the day as they can, to cycle through as many patients as they can, because an empty dialysis machine is $380 that they're not making.
Okay, so a company making sure that their machines are being used at full capacity is actually, there's nothing inherently wrong with that. That is a company just using its resources efficiently, administering a life-saving treatment. But that's kind of just the beginning. What you see in these for-profit dialysis centers is less staff to help with the treatment, and you see higher death rates. And this is where it becomes so clear where the failure is. You see 17% fewer referrals for kidney transplant. Meaning these people who are on a temporary dialysis intervention, who are supposed to be waiting for a kidney transplant, are kept on the machines longer because a for-profit company makes money the longer they're in the chair. So why would they refer them to get a kidney transplant when they make more money keeping them on the dialysis treatment? If someone gets a transplant, that is a lost customer.
Unfortunately, it's an option that's being denied a lot of people because it's in the financial interest of dialysis centers to keep someone in dialysis rather than, quote, losing them to transplant.
Now, DaVita has paid like $1 billion in settlements and for some of this behavior, including $350 million they had to pay after being sued by the US government for paying doctors to go out to recruit people to come to their dialysis centers so that they could corner the market in certain areas. They had to pay another $450 million because they were found billing the government for medicine that they had received and just thrown out, and charged the government anyway so that they could get reimbursed. All of this, once again, further draining the money that is allocated by our government to help people in need. And finally, number 6, the last on our list, the one I'm deeming the most egregious because it has to do with children. And not just any children, the most vulnerable children in our society. Specifically children who have been removed from their family because of abuse, abandonment, or death. Foster children. If a foster child loses a parent or is physically or mentally disabled, the federal government entitles them to around $700 a month to subsidize their lives. This is one that goes straight from the federal government, from the Social Security Fund, straight to these children, or at least it should. But here comes the corporate middleman once again. States